Our next entrepreneur is Dr. David Schroeder from Wellesley Personal Care.
Hi, David.
Hi, how are you?
Good, thank you. David, first, why don't you tell us about Wellesley Personal Care?
Well, first of all, let me thank you very much for inviting me here. It's a real pleasure.
Well, after a segment with Joel, let's see if you still say that.
Okay, well, I'll say. Is he from Toronto, by the way?
He is from Toronto.
He is from Toronto,
We
yes.
flew him in
Yeah.
just to interview you.
Well, I went to medical school up there.
Really?
Really?
That's right.
Couldn't get into an
Yeah, I was
American
gonna
school.
say
huh?
that.
That was cheap.
Couldn't make America.
I understand. Joel and I both sent our kids to the university in Canada.
Right.
We're both graduates of Canadian schools, but not Toronto. You went to medical school in Toronto?
McMaster in Hamilton.
Oh, wow.
And then I
Good
was
school, lousy town.
Steel town.
Right. And then I was at McGill for a number of years.
Ah,
And
okay.
did your residency at McGill?
Residency and fellowship at McGill.
At the Royal Vic?
At Montreal General and the Vic.
Oh,
I
boy.
was born in the Royal Vic.
Oh,
I was
there you
born
go.
in the Montreal General.
See?
Wow.
Wow, and you worked at both places. There's something to this.
That's right. And then I ran a little ICU down in Montreal for 2 years.
Very
And
nice.
then came to Boston, so.
Well, that's very interesting. So, but you're not Canadian.
I'm not Canadian, no.
No, you just went there because the fees are cheaper.
Fees were cheaper and
Typical American
they
employee.
just gave me a tremendous offer. At that point in time, the province of Ontario had plenty of money. So they,
Not so much anymore.
right. Well, this was in the 70s.
Right, for sure.
You were asking about Wellesley Personal Care. Wellesley Personal Care is a concierge practice that we put together last year. We started the 1st of January, and it's off and running.
Right?
How
How many doctors are in it?
One doctor.
Okay.
I'm it.
You're it.
We have approximately 450 patients at this point in time.
You're a GP?
I'm an internist.
You're an internist. Okay.
And we, so far so good. Compared to the kind of system that we had in the past, this is a huge improvement.
You know, I want to talk to you about this because, you know, I know it's a business, but still, it's still, this whole concierge practice, I already lost one GP to concierge about a dozen years ago, and you know, my GP now is, you know, it looks like he needs me more than I need him because
Yeah.
I'm a consultant. I walk into his office and he's overwhelmed. Do you see any light at the end of the tunnel for our, you know, in terms of giving people proper service in this area? Just no one seems to want to be, there's just too many patients for the amount of doctors that are out there right now.
Well, the changes in internal medicine and family practice and primary care have been enormous over the past 20 years. When I first came to Wellesley and took over a practice in 1990, I was following all my patients in the hospital. I was making house calls, and I was seeing patients on a regular basis in the office, and it was very doable. Over time, that situation has changed enormously. One of the problems is that there's a huge shortage of primary care physicians. Another problem is that reimbursement is not kept up with costs. So if you're an independent physician, it means that you really have to hustle tremendously. Given the fact that there are not enough primary care physicians, physicians are overloaded with patients. So whereas years ago you would see maybe one patient every 20 minutes or half an hour or something like that, now you have the 11-minute visit.
Wow, that's long.
It's a lot, well, I mean, that's what I was doing.
Right.
And on an average day, until forming the concierge practice, I would see between 30 and 40 people. Now, one of the problems with that, especially if you have complex patients, is that you don't have time to really sit down, talk with people, form hypotheses, and really treat people in the proper way. On top of that, because you have this kind of volume, you don't have time to do the other things that you did in the past. For example, go to the hospital, see people at home, and really establish human relationships. Because I think one of the most important things now, in spite of all the imaging, in spite of all the technology, despite all of the real positive things that have happened as far as medical science is concerned, is that there's a lack of human interaction.
But isn't this a practice